So you've been given a diagnosis like spondylolisthesis. It's a lot to take in, and right away it brings up one huge question. In this guide, we're going to get some real clarity on that question and help you figure out the path forward. Spondylolisthesis. Wow, that is a mouthful, isn't it? But all it really means is that one of your vertebrae has slipped forward a bit. Still, hearing that word for the first time, it can definitely stop you in your tracks. Because, right after you hear that diagnosis, another word usually pops into the conversation: fusion. And that leads straight to the big, heavy question that's probably weighing on you right now. This is it, isn't it? The number one concern. And for good reason. You're wondering, is there another way? Can I avoid something major? Honestly, the uncertainty around this one question can be the toughest part of the whole thing. So here's what we're going to do. Let's treat this like a personal one-on-one consultation. We're going to go through the exact framework that a spine specialist like Dr. Kamal Woods uses, so you can walk away from this feeling informed and confident, not scared and overwhelmed. And this right here, this is the most important place to start. A decision this big is never, ever about just one picture on an MRI. It's about you, what you're feeling, and the life you want to live. Okay, so let's dive right in. When does fusion surgery even become a serious possibility? What are the signs? Well, fusion really gets on the table when a few key things are all happening at once. First, we see real, confirmed instability in the spine. Second, you're dealing with nerve symptoms that just won't quit. That pain, numbness, or weakness going down your legs. Third, it's when your day-to-day life is really being impacted. Just walking or standing becomes a major challenge. And finally, it's an option after you've really given conservative care, like physical therapy, a good, honest try, and it just isn't giving you that lasting relief. All right, this next idea is so important to get. I really want you to wrap your head around this. We need to shift our focus away from the scary-sounding diagnosis and onto the real mechanical problem. So think of it like this: the slippage on your MRI. That's just the diagnosis, the name for what we see. But the real problem, the thing that's actually causing your pain and holding you back, is instability. Is that part of your spine moving around in a way it shouldn't, pinching nerves? That's the real question. Because just having a slip, even a pretty big one, doesn't automatically mean you need surgery. It's the instability that we really need to pay attention to. Once you understand that difference, it lets us use a really clear, simple framework to look at the whole situation. It's a three-part decision that puts all the puzzle pieces together. So here it is. Step 1 is stability. What do the images actually show? Is there movement where there shouldn't be? Step 2 is symptoms. What are you feeling? Is it mostly back pain, or is it that sharp nerve pain down the leg? And step 3, maybe the most important, is function. What can't you do that you want to do? For the right decision to become clear, these 3 things really have to tell the same story. And this chart breaks it down perfectly. On the left, you see the situation where things like physical therapy might be all you need. The slip is stable, the pain is mostly in your back, and you feel better with therapy. Your life is manageable. But on the right, you see a totally different picture. There's real instability, that persistent leg pain is there, and just getting through the day is a struggle. You see, it's a clear contrast between managing a stable problem and fixing an unstable one. Okay, let's talk about some of the big questions and worries that I'm sure are on your mind through all of this. This one is huge. People always want to know, can I just do physical therapy and make this whole thing go away? Okay, so here's the honest truth about physical therapy. It can be a game changer. It absolutely can strengthen all those muscles that support your spine and can make a massive difference in your symptoms. But what it can't do is literally push that vertebra back into place. It can't reverse the slip. Now, for many people with stable cases, PT is all they'll ever need to live a great, comfortable life. But if the problem is true instability, therapy is more about managing this situation, not correcting the root mechanical issue. And then, of course, there's the elephant in the room, the surgery itself. Is it safe? It's a completely fair and really important question to ask. The reality is, lumbar fusion today is a completely different world from what it was years ago. We now use minimally invasive approaches that spare your muscles, and we have robotic assistance that gives us incredible precision. And what does that mean for you? Well, it means fewer complications and a much shorter, easier recovery. For the right person, it has become a very safe and incredibly effective procedure. All right, let's bring this out of the clinic for a second and talk about what this whole decision process actually feels like for a real person, someone just like you. But before we hear their story, I just want to pause and say this. If you're feeling lost, uncertain, maybe even a little scared. That is so, so normal. You're definitely not the only person who has ever felt this way. And this is what it feels like when it all clicks. This patient said, he showed me the instability on my x-rays and connected it to the exact symptoms I was experiencing. For the first time, the recommendation made sense. He gave me the information I needed to make my own decision. That changed everything. Do you see it? That moment where the picture on the screen connects to the feeling in your leg, that's when the fear starts to fade and you feel empowered to make a confident choice. That's what changes everything. So how do we pull all of this together for you? How do you get to a place where you feel genuinely good about the decision you're making? Well, it all comes back to this one idea from Dr. Woods. The right answer isn't hiding in an MRI report. The right answer appears when the imaging, your symptoms, and your personal goals all line up and point in the same direction. When those three things are in sync, the path forward becomes obvious, both to you and your doctor. And let's never forget why we're even having this conversation. The goal of any of this, therapy or surgery, it's not just to make an X-ray look better. The real goal is to get you a meaningful, real-world improvement in your quality of life. So, as we wrap up, the final and most important question isn't for me or any doctor to answer. It's for you. What does a meaningful improvement actually look like for you? Is it being able to walk your dog around the block without that leg pain? Is it getting down on the floor to play with your grandkids? Getting that goal clear in your own mind, that's the true first step toward making your confident choice.